This video is intended for scribes to watch before attending a CBC in which they will voluntarily assist the faculty in grading out patients and students. The scribe duty is very important to faculty. We depend on you in order to prevent cross-contamination with the patient and the paperwork. Your job is going to begin first thing in the morning at 8 o'clock or 1 o'clock, depending on which clinic session the CBC is taking place, and will end towards the end of the session around 11:30 or 4:30. Okay. The first thing that we're going to need to do is we're going to need to work with the timestamp. The timestamp is what ensures that the student is staying within their allotted time frame. The timestamp is located in the closet directly to the right when you walk in the South Wing Clinic. We are going to be timestamping the purple sheet, which is this sheet right here, and we want to timestamp along the left side of, I should say the right side, I'm looking at the computer, the right side of the paper. We would like to have at least one person that generally stays in that closet and works with the timestamp, just so that we have less confusion of people running in and out. After the first check-in, so the student will come in, they'll get checked in, we'll go ahead and timestamp them in, their hour will start, they will complete their first hour and all of their paperwork, and then they will bring their packet of paperwork to the scribe who is in the closet, and they will go ahead and timestamp them out. After that first hour, we want a scribe to go and call a faculty over and let them know which chair needs evaluation. The faculty will then work with that scribe to check the patient in and do a quick evaluation of probing depths and recession. So as a scribe, you're going to go ahead and you're going to keep the packet. You're going to not have any gloves on. You're going to stay as the clean person. You're going to go ahead and get a stand, a Mayo stand, to write all of the information down on. The faculty member will sit down and they are going to go ahead and start with first reviewing any health history concerns that may be listed, and then vitals as well, making sure that they're safe. They will then complete the EO-IO form, which is the purple form. So you will go ahead and look at this form and make sure that as the faculty is describing anything, it looks similar. After that, they're going to go ahead and skip over to the perio charting. This is the triplicate form. Now you need to make sure that you don't write anything on top of the triplicate form. That's really, really important. So on your Mayo stand, separate your triplicate form and all of the other paperwork so that they're not overlapping at any point, okay? You're going to go ahead with the probing depths. You're going to stay on the white page for this, okay? So as your faculty goes along and calls out the probing depth, you are going to write down any number that is greater than 1 millimeter. So if the patient has a 3, perhaps that's what the student said, and the faculty calls that a 4, you skip over. You don't need to write down that 4 millimeter. However, if the student claims it's a 3 but the faculty says it's a 5, then you need to write in the gray line directly above that 5 millimeter, okay? So you should only have numbers in this gray line that are more than 1 millimeter greater than what the student is claiming. In the situation that there is a probing depth that is greater than 1 millimeter difference between what the faculty and student are saying, we're going to need a second grader to come in. That second grader will be asked to check the probing depth number that is of question. Please do not tell the grader that is sitting down, the second faculty, what the previous faculty found it to be. Okay, we want to try and keep that as anonymous as we can so that when the faculty are sitting down, they're just calling out the numbers as they see them. Okay, then we will go ahead and check through the recession as well. I should say you should complete the probing and the recession with the first faculty before we pull a second faculty over. It's unnecessary to kind of jump in between. We're just going to have the first faculty complete all of their data collection, and then if necessary, we'll bring in a second faculty to go in and double check the numbers that the first faculty may have not been in line with the student. So once that second faculty, if necessary, completes their recording, then we're going to go ahead and bring the patient, the student back in, okay? But before we do that, what we're going to go ahead and do with the first faculty, once they complete their probing and recession, we're going to have them double check the calculus. You are simply going to circle where they found the calculus if they're in agreement with the student, or you're going to write in where they found calculus but the student did not, okay? If the student placed calculus there but it's not in agreement with the faculty, you are not going to circle that, okay? So it is beneficial for you to use a color other than what the student wrote in. So if the student wrote in pencil, you can write in pen. If the student wrote in pen, use an alternative color so that it's easier for the faculty to evaluate. The faculty will then be asked to evaluate the bottom half of this form. So again, what we're going to have is the first faculty complete probing depth and recession along with calculus assessment. And then if we need a second faculty, they will come in afterwards and you will just specifically tell them which site you want them to check and whether you want them to check the probing depth or the recession. After that, we're going to go ahead. You are going to go and let the student know that they are ready to come back in, that they've officially been checked in. The faculty may or may not discuss the options with you. If there was more than one option submitted by the student, the faculty will let you know, we've accepted the first option, or maybe not, maybe we're accepting the second. So if you could let the student know when they come back in, hey, just so you're aware, it was option 1 that was accepted, or perhaps option 2. Let the student know that as they're walking back into the clinic, so they know what they need to what they need to scale, and possibly what they need to anesthetize, if they haven't already. Once the student walks back into the clinic, we need to make sure they check back in with the timestamp in the closet so that they can get timestamped in. Okay, so they were time-stamped in when they walked into the clinic. They were time-stamped out when they returned all of their documentation so that they could be evaluated. And now they're being clocked in again for their 2-hour period in which they will scale to completion. During this time, there's not a whole lot for the scribes to do. The 2-hour period generally stays about the same with all students. During that time, bring any sort of homework or anything that you may want to work on, any charts that you may need evaluated or fixed as far as any deficiencies that you may have. This is a great time to address those because the faculty will be waiting as well. So this time frame is good for you to kind of just get caught up on with whatever you may need to do. After the 2 hours, you're going to have the student come back to you. Now, what's important to note is, unlike the first check-in in which the student handed you all of their paperwork, this time the student is not going to hand you any paperwork. We are going to have all of their paperwork paper clipped, and it's going to remain in the timestamp room. Okay, the purpose of this is that we actually do some grading on this during that 2 hours. So when the student comes back, they're going to let you know what their box number is. You're going to match up their box number with the paperwork, timestamp them out. The student will then exit, and then you can go with your paperwork or let another scribe know that this student needs to be have their final skill check. So in this situation, you're going to go ahead, walk over with the faculty. You will no longer need the purple sheet here. You're only going to need the triplicate form. Okay? You're going to get your Mayo stand like you did previously, and you are going to be working in this lower section down here. These are the teeth number. The faculty will have already denoted which teeth are located where. Now the top row is indicated for maxillary teeth, whereas the bottom row is indicated for mandibular teeth. Please make sure that you write the numbers in the correct boxes. As you can see, the tooth numbers are listed above the tooth, okay, not directly below. So what you're going to be doing is, if you can see closely, I'm just going to make sure that you can see. What you're going to be doing is the faculty is going to ask you, as they go through, to make notes about where they are finding their calculus. You can see each one of those boxes has a mesial, facial, distal, and lingual surface. Please note it does not change when you go from maxillary to mandibular. This is opposite to what you may have noticed with your dry erase board. So it's important that we're calling out the correct spot where the faculty is saying it is. Each faculty is assigned randomly a number. They know what their number is, and when you sit down with them, they're going to tell you what their number is. Unlike a normal calculus assessment competency where you're writing down C or a dot for roughness, we're going to be writing down their number, and their number is denoting where they are finding a click of calculus. So for example, you may sit down with a certain faculty member and they may tell you that their number is 12. When you sit down, if they call out perhaps a click of calculus on the mesial of, let's say this is tooth number 8, you're going to put a 12 in the box. However, what I need to, it's a little bit easier to see on this white page, which is why I'm showing you this, but we actually need to do this on the triplicate form. We start on the pink page. The pink page is going to be your first faculty member that you see. The yellow is going to be for the second faculty member that checks the patient. And the white is if for some reason we need a third. We normally don't, but if we do, we will use the white sheet for the third. So you're going to go ahead and write the spots that the faculty is calling out as far as where they are seeing calculus. Please make sure that you write those numbers kind of small in case we have multiple people that are writing, or multiple faculty that are kind of going in the box. The way that the triplicate form bleeds through, if you could be a little bit cautious to not try and overlap as you're moving from the pink page to the yellow page, it makes it a little bit easier for us. Now, if the patient or the faculty calls out RP, that stands for root planing, you're going to put an RP and then their number in the spot that they want. Finally, if they call out T, that's code for tissue, so that's tissue trauma. So we want you to not only write that on the blue sheet, but we also want you to write it on the outside wherever it is located. So interproximal, on the facial, lingual, whatever it happens to be. Please make sure that you write that based on what your faculty is telling you. When you are done, your last job as a scribe is going to be to make sure you have all of the tissue listed that faculty may have called out. Now, we need to make sure that this is not just concurred. Although the student will only get points docked if the tissue trauma is concurred with both faculty, or 3 in the case that there is a third, we still want the student to look at all of the possible tissue trauma that they may have caused, concurred or not. So please make sure you fill this out in its entirety and then return this to the student when the last faculty is completed. We'd like the faculty to not be in the area, just so that the student doesn't have, an idea of who specifically may have been evaluating them. So you're just going to go ahead, you're going to go out into the hall, call the student, give them their tissue form, reiterate to them that this doesn't mean you've lost all these points. It's just one or more faculty found potential tissue trauma in that area, and then the student's going to go back in. So that's pretty much the summary of what you're expected to do as a scribe. Your big thing is going to be time stamping them in and out for their first hour and then for their second hour. Doing the purple sheet, which is where you're going to be kind of reviewing this with the faculty to make sure that if there's any concerns, they're addressed with their health history. To go through the EO-IO form and check off anything here, adding in anything additional that the faculty may have found. Then checking the periocharting and the recession as necessary, making changes or denoting any areas that the faculty found may have been different than what the student found. That'll be your first hour, and then, or the check after the first hour. And then the check after the second hour is going to be set or focused down here, and this is when you're going to be flipping over the pages. So again, the first faculty you'll start on the pink page, second faculty you'll move to the yellow page, and if there is need for a third patient, we'll go ahead and fill that out on the white page. Make sure you ask each faculty when they sit down what their number is. And if you have any questions or you're unsure of what the faculty may have called out, please clarify this with them. We are grading students, and any small error can really be magnified if we have an issue with maybe something being concurred when it shouldn't have been, or vice versa. So if you're unsure or you can't hear your faculty if their voice is muffled by their mask, please ask them to clarify what they're saying before just guessing what you think that they might have called out. If you have any questions, please feel free to ask your faculty. They will clarify any aspect of this process with you. We thank you for your assistance. We can't do CBCs without scribes. They are crucial for us to be able to efficiently get through the grading process. So we really do appreciate all of your hard work and the time that you volunteer to come in to do so. It's a great experience for you to get to know a little bit about what goes on behind the scenes, and I feel gives you a little bit more confidence in working through the CBC process on your own, actually taking the exam. We look forward to working with you, and again, if you have any questions, please let us know.